Hi, everybody. My name is Renee. I'm in Philadelphia, and I'm really happy to be with you today. And those of you who um, rescheduled to accommodate the illness I had last week, I really appreciate that. Um, what I went through really made this whole topic a lot more important to me than it was before. I didn't think that was possible. So hopefully, a lot of what I say will resonate with you. And I will just go ahead and get started. Is that okay, Leo?
Absolutely.
All right. So the topic of tonight's talk is Cuba's model for healthcare, health, education, and internationalism. I have to say that this would not have been possible without this great book written by Don Fitz, Cuban Healthcare, The Ongoing Revolution. It's been amazing, and I thank him for his efforts in contributing to this talk tonight. Also, I couldn't have done this without the input of my dear friend and my colleague, Dr. Leonardo Gonzalez de Dios, who was one of the directors of the Dr. Cosme Ordóñez Carcelar Teaching Polyclinic in Havana. So what I wanted to do first was look at any evidence in Cuba about the earliest records of healthcare. And as you can imagine, it was plant-based. It was based on folk healing and the environment. The Siboney, which were a subgroup of the Taino people, they were on the western and central parts of what is now known as Cuba. They dominated the island, and their type of healthcare delivery dominated the island until the Spanish invasion in about 1450. Interestingly, I didn't realize this about the Siboney, but within the Taino people, that particular group of people was known for not having a hierarchical structure and not having chiefdoms in their society. So I thought that was pretty appropriate for the ancestors of modern day Cuba to be descended from people who didn't have hierarchical structures in their societies. Nonetheless, after the Spanish invasion, bringing over the first African individuals, healthcare was again dominated by plant-based and folk healing, but a lot of it influenced by African traditions. And while Spanish people did kind of dominate the way things were done, the medical care provided by Spain was very rudimentary and it was inferior compared to the plant-based medicine that the Taino and African people brought. And Spanish medicine was even inferior compared to other healthcare systems within Europe, which was quite interesting. Let's see. So looking forward for any examples about this idea about generalized healthcare and community health in Cuba, I came across Tomás Román Romeu y Chacón, who lived in Cuba from 1764 to 1849. He did a lot of things. He taught medical school, he was a physician, he was a poet. He was also very dedicated to disease prevention, and he was a big advocate for hygiene. He was responsible for controlling the smallpox epidemic. So when that swept the island in the early 19th century, and it was recognized that the entire population would be wiped out by the time the antidote actually arrived by ship, he went to the interior of the island himself to isolate the cowpox virus from infected animals and develop a smallpox vaccine. Came back and vaccinated individual Cubans. I thought this portrait was quite telling. This nobleman finally giving these vaccinations to all of these people waiting in line. My attention is drawn to this brown-skinned little girl right in the center of the portrait. You got to wonder if she was actually given a vaccine at all, or if she was there to support this woman who was dying on her shoulder. Maybe she was even something like the royal taster. So she would get the vaccine first, and if she did okay, then everybody else would get the shot. I just find it hard to believe that the distribution was entirely benevolent, but maybe it was. Somebody else that I found that I think contributed to the current reputation of healthcare in Cuba was Carlos Finlay. So he lived in Cuba in the late 19th century, died in the early 20th century. He went to medical school here in Philadelphia, where I live, and he um, really believed in the germ theory of disease, which stands to this day, that diseases, a lot of diseases, are carried by pathogens, bacteria, fungi, viruses, and that by controlling those organisms, you can control disease. He was very aware of yellow fever and the fact that the virus that caused yellow fever was carried by mosquitoes. And he was able to make the connection between control of yellow fever and general health and mosquito control. So it was a good example of efforts on the island in the early 20th century for public health. So the first half of the 20th century in Cuba, the healthcare was dominated by a few things or influenced by a few things. First of all, tropical medicine. Given the location of the island geographically, there would be diseases, pathogens never seen before, needing to be classified and understood and recognized and treated. So tropical medicine really expanded. The idea of preventive medicine came into being, but not so much about what can we do for people to avoid chronic diseases, but what can we do for people to avoid current infections like yellow fever, malaria, things like that. There was an awareness about the importance of rural health, but not so much about the health of the individuals who live in rural areas, but the control of the rural environment so people who lived in the cities could stay healthy. So along with those developments, the Cuban Medical Federation came into being, the Cuban Communist Party came into being, and those two groups really helped to solidify the ideas around the rights of the worker. Physicians were workers and are still workers. So really considering minimum wages for those individuals, protection on the job, sanitary conditions to keep those people safe and allowing them to do their jobs effectively. So all of that was influential in the early 20th century. And along with that, there was this rise of mutualism. So mutualism refers to self-financed assistance for healthcare. So individual doctors, hospitals, pharmacies would group together, charge a monthly fee, and then provide services within their group. Different groups had different plans depending on who the individuals were, how much money they had, how much money they paid, what kind of work they did. Might sound familiar. This is insurance now. This is what we have. And it was present in Cuba then. There was also private free fee for service. So you could standardly go to a physician, pay him, and it was a man, a certain amount of money and get the care that you needed. There was a state medical system for healthcare, but it was not as robust as mutualism and individual fee for services. So by 1959, the year of the revolution, this was really the state of things. Mutualism and fee for service care made up about 43% of medical services provided. There was the state medical system, but it clearly really wasn't enough. Over half of all healthcare on the island was in Havana. So if you were a doctor in Havana, it was a nice life. You had maybe 250 patients and that was it. That's not a lot. In other parts of the island, however, it was a lot worse. So one doctor would be responsible for over 2,500 patients. That's like impossible. Medicine was curative. It was focused on dealing with the problem as it presented, not preventing the problem from happening in the first place. The pharmaceutical industry was 70% foreign owned, and by foreign, I mean the United States. Also, hopefully this is going to go. I don't know why this isn't. There we go. 10% of children had access to pediatricians. So most kids didn't have access to a specialist physician. There were no vaccination programs, and medical education was very poor. It was theoretical. There was no practical training. You read, you pontificated, you sat and you discussed and you debated. And after a certain amount of time, everybody decided that you could be a doctor. That was healthcare education. That was preparing people to be physicians. And there was a lot of focus on making money, despite the fact that most doctors really didn't know what they were doing. Despite all of that, with the revolution, half of Cuba's 6,000 doctors left. So the number of doctors who were even providing this kind of care was abruptly cut in half. So I think that this is a very telling quote from Fidel. And when I read it, I realized this is what he had been thinking from the revolution on. I'm not a medical doctor. I'm a promoter of the health program. And sometimes I've used different words when asked, are you a doctor? Well, are you a doctor, or are you coming up with these ideas? How do you know that this is going to work? I've humbly said, I'm not a doctor. I'm a health strategist. And I think that is really telling and is responsible for the success, I think, the success of the healthcare program in Cuba. So in 1959, a young Fidel looked at the problem and he said, okay, these are the issues we have to deal with right away. There is no national health plan. Currently, private services are better than governmental ones, even though they're not so great. There is this orientation towards curative medicine. The rural areas and a lot of the urban areas are abandoned. Medicine is very individualized, and the public is unaware about treatment that's available to them. So what do we need to do first? Create infrastructure. The focus was on rural parts of Cuba. So by 1963, over 100 rural health centers were built. Over 40 hospitals were built. The Ministerio de Salud Pública, the public health ministry, was created, which was just a boon. Law 723 came into existence, which promoted and detailed how to support rural health and providing rural health services. So it was understood that the mutualist clinics were not so great, but they did make up a significant amount of the healthcare delivery. They were necessary, again, with this dearth of physicians. And so they were kept in place with the expectation that they eventually would just dribble off the court as Cuba was able to create a healthcare system that was better. They also decided that part of the infrastructure needed to include medical education. They needed to make more doctors as soon as possible, and part of medical education needed to include 1 year of rural service. And so by focusing on rural health, it was very effective. 1,500 doctors were created about 4 years after the revolution, again, building more hospitals, building more clinics. Vaccination campaigns were restarted pretty quickly. So diphtheria, pertussis, tetanus, that vaccination rate doubled. The anti-malaria campaign kicked in. And then also polio vaccination campaign started up again, clean water campaign started up again, gastroenteritis control became a regular campaign, and animals were not excluded from the healthcare plan. Anti-rabies campaign was also started up at the same time. Those are just some examples. Again, looking at the state of the Cuban doctor, not only in terms of practice and ability to provide healthcare, but even teaching doctors, there was a shortage. With that loss of 50% of doctors, only 19 professors remained in the one medical school that Cuba had. So how could they fix that immediately? Have the doctors who were currently practicing teach more students. So they designated a lot of hospitals as teaching hospitals, and they opened more medical schools on the island. And while they were doing that, they also asked for assistance from other countries and brought in instructors and materials to help build the program and help educate new doctors. Doctors were quoted as saying things like, "Where was I going to work? Wherever the revolution needed me," mostly in rural Cuba. There was an enthusiasm for working in the rural areas and serving the underserved. So I want to try to tie in the connection between the growth of the healthcare system in Cuba and the development of the system and the development of medical internationalism, because they were simultaneous. Again, bringing in instructors and supplies in the beginning was necessary because there was a shortage. So Cuba was affected by the generosity of nations like Czechoslovakia, Bulgaria, East Germany. The idea about solidarity and working together for common goals was really reinforced by those partnerships. Also, at the time that Cuba was in need, Algeria was enjoying, if you can use that word, its freedom, its independence from France, which was great, but there was a huge brain drain, just like the revolution in Cuba. So Algeria lost a lot of their physicians with the successful revolution. So Fidel looked at that and said, okay, while we are building our own program and getting help from other nations, we still have to help other people in need. In Algeria, there are 4 million more individuals, but they only have a third of the doctors that we do. So he very generously sent Cuban health workers, 29 of whom were physicians, to Algeria to help maintain health and build a healthcare program in that nation. So there was already this early connection, recognizing that our plight is the plight of other nations, and the borders and the geography really don't matter. It's the history and it's the solidarity, and we all have to rise up together. So again, I also think that the idea about medical internationalism was burnished by efforts within Cuba to work on promoting rural health, with the understanding that the differentiation in care and education, et cetera, and health between urban Cuba and rural Cuba was unfair and needed to be equalized. And so, again, that struggle for equality and equity and equal access, it was an easy jump, I think, for proponents to recognize that those efforts needed to be spread across the world simultaneously when they were called on to do so. So about 10 years after the revolution, healthcare was better, but there was still a problem. It was really disjointed. So you still had fee for service and the mutualist clinics, small plans, large plans, public assistance, rare preventative medicine. So what did Fidel and the health ministry come up with? The idea of the polyclinic. So the Policlinico Integral, the first one was set up in 1964 in Marianao. And the idea was that in one building, you could have multiple providers, general practice physician, nurse, pediatrician, OBGYN, social worker, dentistry. So patients could go to the clinic and those providers could provide house calls as needed in those communities. So they were centralized and at the same time they were decentralized. The Ministry of Health could give directives to the polyclinics about things that were needed for the island, region by region. Things like prevent tuberculosis, drop the number of leprosy cases, improve venereal disease outcomes. And then each polyclinic can take those directives and carry them out according to the needs of their environments, the needs of their individuals, and also the support they had from other community groups. The polyclinics were very, very successful quickly. As you can imagine, having a centralized resource for vaccines, the campaign, the vaccination rates soared. Malaria was eradicated. Diphtheria was eradicated. Hospital admissions dropped. And that's a real sign of a healthy healthcare system when patients don't have to go to the hospital for complications. They can see a clinic or another physician first before their disease is too far gone. And the success of the polyclinics was again aided by what was going on in individual communities. The literacy campaign, improving racial discrimination, land reform, giving salaries to agricultural workers, improving farming methods, keeping people safe as they did the work, keeping people safe as they ate the food, improving diet, pensions, giving people more money to live their lives, improving the roads so people could get back and forth more easily, creating classrooms, improving classrooms for learning, expanding housing, giving indoor plumbing to more individuals. All of that combined to facilitate the success of the polyclinic. So there again were a lot of vital community collaborations, and I just tried to boil down some specific examples just to make it clear that these medical facilities were not working in a vacuum, and they were not the sole provider of healthcare, and they knew it. And they knew that they couldn't be the sole providers of healthcare. National Association of Small Farmers really helped to mobilize farmers, talk to them about how to stay safe, how to stay healthy, how to be active and proactive in our own health. The Federation of Cuban Women focused on maternal fetal health, education, nutritional needs, and promotion of nutrition. Confederation of Cuban Workers looked at workplace safety for all individuals. The committees for the defense of the revolution were very key. So they were begun to defend Cuba against US attacks. And in that preparation, they had to have a network across the island, among neighborhoods, between cities. And it was clear that that network could facilitate healthcare if you needed to control vectors of disease, insects, if you needed to have a blood drive, if you needed to improve sanitation, build schools and parks. The CDR, if they couldn't do the work, they could spread the word and support the work being done. With all of that, all of those groups are examples of necessary parts of a community's healthcare system. And the director of the local polyclinic was also the chair of the Health Commission, which partnered, again, equally with all of these groups. So as the polyclinics rose, were very, very successful, met a lot of goals quickly. Mutualism, as expected, just kind of dribbled off the court. So after 1967, the health ministry took over the budget, which meant that the mutualist clinic could not provide different care compared to other government-funded health services. They had to provide the same. They couldn't charge more. They couldn't do more. So by 1970, they stopped accepting new patients. They stopped charging dues because they couldn't. They realized, okay, there's no money in this anymore. So they just stopped. They closed their doors. Easy peasy, because people were going to polyclinics for care anyway. And also the health ministry was guiding all services. So it was an easy exit for the mutualist clinics. Going back to what was happening with the Cuban physicians within Cuba and the doctors who were being sent abroad, they were looking at what was going on around the world as they were promoting and maintaining health on the island. And they identified with these things. The civil rights movement and autonomy for people of African descent in the United States, they identified with that. They identified with people who were opposing the Vietnam War, fighting for freedom from French colonialism in Algeria, really feeling a solidarity with people in China in the Cultural Revolution who were combating the growth of capitalism, looking at how Arbenz was overthrown in Guatemala, how the US invaded the Dominican Republic in 1965, on their own shores, the Bay of Pigs invasion and how that failed. They also looked at this purported ally, the USSR, and how they weren't really helping anything. So Cubans decided, well, what can we do? Where can we help? And they looked to the African nations, and they certainly saw solidarity because of the heritage. More than 33% of people on the island had African roots. And also, people in Africa were more open to working with Cuba because they felt that connection and they felt that sense of solidarity and that shared history. So the first forays of Cuba's military doctors were to places like Zaire, Congo, Guinea-Bissau, Angola, Cameroon, Equatorial Guinea, and Tanzania. These were not your standard missionary physicians. So a lot of these physicians were going with soldiers, with troops. A lot of them were going on their own with nurses and other healthcare providers. They were going where the care was needed. They weren't in one location and everybody traveled to them. They walked, they rode horses, wherever the care was needed. They could have been soldiers facing combat wounds or people having babies. It didn't matter to these doctors. So back to the polyclinics, it was working great, but within 5 years, they weren't enough. They were working beyond their capacity. They became very complex because there were more duties that were demanded of them that really weren't recognized. Because they were so busy, the physicians really didn't work as teams. The patients didn't have single physicians that were following them, and there was a lot of dissatisfaction among patients and physicians. And so the ministry realized that they needed to support that, they needed to change things quickly. So they were able to act pretty fast. They thought that, again, big problem is most physicians were specialty trained. They weren't focusing on primary care. That was a problem. Also, medicine was not focusing on prevention. It was still curative. And there were no opportunities for community involvement in healthcare. So while that was happening in the beginning, things got so busy so fast that the community involvement really got shut out. So they tried to make some changes. And they developed the policlínicos comunitarios. So basically taking the polyclinics and making them smaller and making more of them, putting medicine closer into the community. So physicians provided clinic visits to look at each individual and classify their health risks. But then they followed this up with home visits to make sure that what the patient said was true. Do you eat a lot of salt? No, I don't eat a lot of salt. And then you go to their home and you say, okay, well, your kitchen's full of cured meat and there's a lot of salt here on the counter. I don't think you recognize, maybe you don't really understand what salt is. Maybe you're not really telling the truth. So it was a way to look at the whole patient and get a better idea about what they needed and work towards this idea about preventative health care. It was easier to provide health education in these smaller settings. These polyclinics were able to accommodate multi-level teaching, meaning students, residents, nurses, dentists, pharmacists, you name it. Universities were able to more easily collaborate with these polyclinics to do their research. And again, because they were smaller and more connected to the communities, there was a reestablishment with community organizations for unified health. So this is an example of one of these polyclinics, Cosme Ordóñez Carcelar Teaching Polyclinic in Havana. And if I haven't said it before, the big principles of the Cuban healthcare system are really embodied by one of the talks that they gave. Healthcare is universal, it is free of charge, it is accessible, it is regionalized, and it is comprehensive. It's equally accessible to all citizens, regardless of where they live, regardless of their political affiliation, regardless of gender or race, regardless of religious beliefs. And again, based on internationalism. So we will provide this care wherever it is needed to whomever we can reach, whether it's in Cuba or beyond. And at this particular clinic, they did roll out the community medicine model and started the first comprehensive general medical residency. And this was really important, the comprehensive general medicine program. So this was a specialized training course for physicians to address the need for a focus on preventative care, not curative medicine. So these physicians are trained with the understanding that health and illness are conditioned by the interaction of people as biosocial beings with their environment. So these comprehensive general medicine physicians grew in number and are really responsible for the increased success that Cuba has seen with its healthcare system. There were still challenges despite those efforts. I think it was amazing that Cuba has made all of these, had all of these successes, but still looked at ways that they could improve. There was still not enough emphasis on psychological, social, environmental factors of health. Doctors were still looking for symptoms rather than ways to prevent disease. Healthy lifestyle was still not vigorous, was not advocated for as vigorously as it could have been. The polyclinics were great, but there was still a difference in the care provided depending on whether they were teaching clinics or non-teaching clinics. And despite the comprehensive general medicine program and the family medicine physicians, still family medicine split, internal medicine, OBGYN, pediatrics, which prevented the ability for holistic medicine, or again, that input by community groups to help affect healthcare for members of the community. Eventually, patients started going to the emergency room instead of the polyclinics because they could get seen sooner. And the big problem was that social factors were still not at the forefront of medical interventions, and physicians and strategists knew that those factors really need to be considered. So what did they do? They created the Family Doctor Nurse Program. And this is part of modern day Cuban medicine. That family doctor, that comprehensive general medicine specialist or family care physician would be in charge of primary care at the neighborhood level. Again, the comprehensive general medicine model. So each team, physician, plus or minus a nurse, and their families live in a consultorio in a neighborhood. So the medical office is on the first floor, the doctors, nurses, and their families live above. It's easy access because they're on the street where everybody lives, and it's more easy to access their patients with home visits, etc. Physicians and nurses in Cuba still prioritize accompanying their patients to the hospital. And this family doctor nurse program facilitates that and makes the standard of care easier to carry out. So physicians and nurses within 2 to 3 entire blocks are responsible for everybody that lives there. They are able to do twice yearly visits for everyone and home visits as needed. Usually they split their days so that there's office hours in the morning or the afternoon, and then home visits in the afternoon or the morning. So these are some pictures from a polyclinic that I visited a few months ago. The woman in the back is Nelis, and she's the nurse, and the woman in the front is Miledis, and she's the physician. So they are responsible for this consultorio, and they do a lot with not a lot, as you can imagine. So these are the healthcare records, yellowed, onion skin dry, and they might have some photocopies, they might have some duplications here and there, but this is really all they got. So God forbid there's a natural disaster or a fire. This is where they keep track of everybody who lives in the neighborhood. And this is the map that they have on the wall. Certainly it's more than 2 to 3 city blocks. Things have grown, but they're aware that this is their area that they are responsible for. And between the two of them, they keep track of who's due for a home visit, who's due for an office visit. So while it's difficult for them to get everything done, again, they achieve a lot. They really focus on prevention and keeping people healthy. So I think that this map of Cuba replaced by vaccination bottles is a perfect example of the efforts, the successful efforts of the consultorios to affect healthcare. I took a picture of this poster in another consultorio that I visited. The images might be familiar to a lot of folks. On the left, it's basically saying, what can you do to improve your health? Exercise, eat healthy, make sure you get sleep, brush your teeth. What should you avoid? Don't smoke, avoid salt and sugar, eat healthy food. So I very cynically asked my colleague, Leonardo, okay, but I know you put these up all over the place, but do patients really pay attention? Because in the United States, we talk about it, our patients don't really listen. They don't really take it too seriously, or most of them don't. And he said, without any irony, oh, yes, they believe it, they understand it, they follow our instructions. So it seems like finally the idea about preventative medicine has been effectively understood, and that the healthcare system is so granular now that individuals really understand that all of these measures are true and necessary, and they're more likely to be compliant about it. So while the consultorios are vital, the polyclinics still have a lot of importance and are necessary. So they are where the specialists go. So if you live in a neighborhood and you need to see the cardiologist, the dermatologist, etc., they'll meet you at the polyclinic. The emergency rooms are at the polyclinics. The polyclinics back up the physicians when the physicians are unavailable. Also, any changes from the World Health Organization, comments about primary health care, updates from the ministry get sent to the polyclinic, and then it's shared with the consultorios in the area. The polyclinics also are responsible for residency programs. So they all teach now, including the comprehensive general medicine residency program. Medical students, again, dentists, nurses, statisticians, pharmacists, everybody's taught at the polyclinic. The polyclinic is the place where statistics are stored if they want to look at their progress, their vaccination rates, maternal fetal health, things like that. It's also where they can carry out clinical trials. So I'll talk a little bit later about some of the trials or some of the successful medications that have come into existence because of clinical trials. They're still actively doing clinical trials for things like pneumonia vaccines now. So would be remiss to not talk about the effect of the special period in the time of peace on healthcare in Cuba then and now. So after the Soviet Union pulled its subsidies and abruptly walked away from Cuba, a lot of things were impacted. Certainly food intake dropped, which led to nutritional deficiencies. From a health point of view, this was devastating for a lot of people. For example, optic neuropathy caused by vitamin D deficiency. Babies had lower birth weights. That was all problematic. There were shortages, still are shortages of running water and soap, shortages of medications, shortages of fuel. Hospitals had less equipment, inability or reduced ability to replace parts of equipment that was aging. In terms of educating medical students and residents, there was no longer the money available to buy medical textbooks in Spanish from Spain or other nations. So they had to figure that out. And again, looking at those polyclinics, they're really frozen in time. So it is amazing how much they do with the little that they have. But this is standardly what a polyclinic, or I'm sorry, a family medicine or consultorio looks like in Cuba now. Um, Nonetheless, the priorities of the revolution and the priorities of healthcare in Cuba did not change. Maternal fetal health is still protected. The number of maternity homes, places for inpatient long-term care for women who have high-risk pregnancies, increased. Pregnant mothers with low-risk pregnancies, healthy pregnancies, had guaranteed access to food via workers' canteens, whether they were employed by those companies or not. No hospital is closed. Medical education remains a priority. Research continues, and physicians have learned to adapt, relying more on their examination skills, their interview skills, relying less on technology, and being more practical in their care. If patients have no symptoms, don't get lab work. That saves a lot of money, one example. So, despite the deficiencies and the challenges, to this day, adult life expectancy in Cuba is higher compared to the United States. The island created two COVID vaccines, which kept their citizens healthy during the pandemic. They were also able to export a lot of those vaccines to other nations. They created an effective treatment for diabetic ulcers. They've created a medication that reverses the effects of Alzheimer's disease. 99% of Cuban children are fully vaccinated. That is significantly higher than the United States, and it's probably going to surpass us by leaps and bounds as time goes on here, given what's going on in this country. And as of this point, notwithstanding the current strangulation of the island, the infant mortality rate is 0 in 1,000. That's remarkable. The United States is 5 in 1,000. And the United States has not improved its infant mortality rate for about the past 10 years. And the brigades continue, the medical brigades continue. So I know, talked about the medical brigades. This is a brief list, I think, of all of the places where Cuban physicians and nurses and other healthcare providers have gone as part of their medical internationalism efforts, this sense of solidarity. So I'm just going to quickly list them here. You'll see most of them are in Africa. The solidarity, the heritage, and the understanding that the fight and the way of dealing with the challenges in healthcare, the way Cuba wanted to do it is the same way that these nations really believe it needs to be done. So one example is Sierra Leone. I just want to bring that into relief. 2014, the Ebola virus ravaged that country. What happened? The United States offered soldiers, other countries promised money. Cuba actually sent nurses, doctors, and then restationed a lot of physicians who were already in Africa into Sierra Leone to help combat the infection and to stop it. So with those efforts, it was Cubans who taught Africans, Latin Americans, and Caribbeans how to treat Ebola without getting infected. People don't talk about that, but Cuba was instrumental in controlling the spread of Ebola. So these pictures are probably familiar to most of us. These are images of what happened with Hurricane Katrina, the aftermath. There was no infrastructure. People with babies, people with health conditions, healthy people just didn't have what they needed. Put in these open air stadiums with no running water, no electricity, no ventilation, no sanitation, left to really fend for themselves. What did they do? People were just clamoring for help, and they threw soldiers in front of them. That was the United States' solution. And I just thought this was a horribly ironic picture. And I think somebody actually draped this flag on this poor woman as she was sitting there looking for help. I think that my batteries are dying on my AirPods. I'm sorry. Talk quickly here. So what did Cuba do? They offered over 1,500 doctors. they provided or they offered 36 tons of medicine to the United States, to which the United States said, go scratch. So Fidel wasn't surprised by this. What did he do in return? He renamed all of the medical brigades after Henry Reeve, who was an American. He fought for the Union in the Civil War, and he fought for Cuban independence, and he actually died in battle. So now these medical brigades are continuing in this tradition of solidarity and medical internationalism.
Let's see. Okay, sorry. Can I still be heard? Because my batteries died on my AirPod. Thank you. I see a thumbs up. Okay. So we now know that the medical brigades, which have been so necessary around the world and have provided income for the Cuban government, are a new target for the United States. This is old news. This lovely man threatened countries in the Caribbean. If you accept care by the Cuban medical brigades, we will deny your US visas. And originally, these nations were in solidarity and said, that's all right, been there, done that. If I never see the United States again, it's all right. So what did Rubio do? Well, he just went to the Caribbean and had private conversations with these nations. And the last I heard, at least the Bahamas caved. So they asked the medical mission healthcare providers to leave. Maybe they got some money from the United States, but they certainly didn't get any doctors to replace these people. So it's horrible, but it is happening. I'll briefly talk about the Escuela Latinoamericana de Medicina, or ELAM, just because I think this is another bright spot in Cuba's healthcare system. And it again drives home the idea of the undying goal and activity of medical internationalism. So this is in Havana, and students from the Global South and the United States who are committed to working in underserved communities can go to this school free of charge. Room and board, supplies, basic toiletries, bedding, monthly stipend, while meager, are provided. Students just have to get there. So for 2 years, they learn intensive Spanish, they learn basic science, they basically learn everything that they need to get into medical school, no matter where they're from. Once they've met all of those requirements after 2 years, they work side by side with medical students in Cuba. They do the rotations, they go to the consultorios, they have the same education. So they graduate as physicians with Cuban medical students. And this program is creating physicians who understand the factors that impact health and who are normalized to the concept of serving the entire person in need of care. Again, that idea of preventative medicine as opposed to curative medicine. So this was a heartwarming picture. This was earlier this week. You know, the UN business is going on. Cuba does have representation there. The gentleman in the middle, I believe, I'm blanking on his name, but he's the foreign minister, and he invited recent US grads of ELAM to meet with him in New York to talk about their experiences and to congratulate them and thank them, and to reinforce to them their solidarity with Cuba and Cuba's pride in educating them as they go forward. So I thought that was really heartwarming. And a lot of these physicians are doing amazing things. They're not all in traditional medicine. So in summary, in my opinion, Cuba's healthcare system began with the idea of community health. It was sidetracked by an obsession with profit, but then it was reharnessed by the revolution and redirected back to the community. And so again, while simultaneously growing and providing what was needed in Cuba, it was expanding its offerings to the world to equally promote and support healthcare everywhere. And what's fascinating is that the program has transformed as humanity's needs have evolved. It's self-perpetuating, it's expansive, and it's just invaluable. So despite all of the challenges, it's doing amazing things. And I really hope that I drove that home tonight. These are two ads that I'm just going to throw out there. I'm not sure if the one on the left is ready for prime time. Maybe somebody could comment about it. But these are two drives by the Pan American Medical Association. I know that the founder of the Pan American Medical Association is an Elam grad. And so while he is working on practicing healthcare in the United States, he's also got this idea about solidarity and internationalism and supporting Cuba and supporting the medical students who are in Elam now. So I think if it's confirmed in the comments, you could go to these links and do what you can to support much needed sutures in Cuba and painkillers, ibuprofen, Tylenol, etc. So I thank you very much for your time. And Leo, I don't know if you want to try the breakout rooms or you want to change the plan right now. What do you think?
I think after all of that wonderful information, I think going into breakout rooms would be a smart idea. Um, so if you could bring up those questions, it'd be fantastic.
Okay. So as you get into smaller groups, I just threw out some ideas, some topics to get the conversations going if you're interested. So you can think about comparing and contrasting Cuban and US healthcare delivery systems. Ask yourself if you think medicine in Cuba could have been revolutionized if all of those doctors stayed after 1959. Are you personally familiar with other countries that have a medical system like Cuba's? Do you have any personal experience with medicine in more than one country, maybe specifically the United States versus Cuba? And then finally, think about a recent illness or injury that you've had. What is your perspective as to its cause, treatment, or cure? And how would that perspective be different if you were cared for within the Cuban healthcare system? So those are my thoughts and suggestions. And thank you, everybody, very much for your time.
All right. So we'll just kind of questions, right, are on the screen. I'm going to randomly put you guys into breakout groups. Hopefully this should work. Give me a
Am I going in a breakout room or no?
You can if you'd like.
I don't know. I just don't know what to do with my screen. That's all.
I don't know how to go into a breakout room. I'm trying to figure it out. Oh, you're muted maybe, or
I am
wait. Yeah.
I'm assigning people right this second. I'm sorry, guys.
Oh, you're fine. Okay.
Hello, everybody. Welcome back. Welcome
Leo,
back.
did you get a haircut?
I did. I
It
did.
looks fantastic, comrade.
Thank you, Hope. Thank you so much. Um, well, thank you. And welcome back, everybody, from the breakout groups. So just gonna take the next little bit of time. We want to hear what you guys talked about. And yeah. Are there any volunteers who want to like kind of just give a brief summary of what they talked about? Go ahead, Howard.
Yeah, so we talked a little bit about this. I just told Renee that I thought in seeing lots of presentations for decades that this is one of the best, most comprehensive presentations I've ever seen. Um, because not just because it dealt with what happened since the 1959 revolution, but gave a real great historical background. I think the challenge right now is a worldwide challenge in the fact that the colonial, white supremacist model of medicine that was developed basically is falling apart everywhere that it exists. And the only place where it's fundamentally been changed, at least for the last 66 years, has been in Cuba. It was changed initially in China, and then that faded away after the Cultural Revolution and after the reestablishment of capitalism, where the system now is nowhere like it was at all before 1976. So I think what we have to do is to figure out what does that mean in terms of us inside the United States. And one of the things that some of us have done is to really re-examine what we did in the Rainbow Coalition, not just in Chicago with the Panthers, the Young Lords, the Young Patriots, but with AIM and other groups around the country, where lots of people who were not in the medical system did community health care. You don't have to go to medical school to learn how to use a microscope. You don't have to go to medical school to learn how to give a vaccine. There are hundreds of people in this country giving vaccines who are lay vaccinators. So I think what we have to think is a very horizontal model. And this includes within Cuba, where they've now established community health workers in the last decade. Because as great as the clinics and polyclinics are, you've got to also be out everywhere in the community, and that can't just be health professionals. It's got to be the people themselves.
Thank you, Howard. Sounds like powerful stuff. Absolutely agree. Tobin?
Yeah, I'd like to chime in on the quality of this presentation. It was I'm coming away richer for this. It's like, where do you start? And where we started and what strikes me is this was not directly related to the medical system. I kind of talked about my own medical experience 11 years ago and going into debt despite having an employer-backed insurance. Um, the level of care when you try to crack the mystery of what how a country um, that that is so in need of resources can provide the level of, and quality of care. It's driven by more than necessity, and that goes back to the phrase that we heard again and again in Cuba. Uh, that's solidarity. Uh, the culture, the culture that just takes years and years to develop. Right there, I cannot see this. I cannot see the medical internationalism, everything we talked about this evening coming off without a genuine culture of solidarity. People looking out for other people. Um, your needs are, your needs are my needs, our welfare. We depend on each other. Um, that that you cannot substitute that. You can't find a surrogate for that. That's that's incredible. And that's, yeah, that was what I was thinking of.
Thank you, Tobin. Thank you all for sharing. I don't know if there's anybody else that would like to kind of share what was discussed in their little breakout groups. Um, if not, I have like a comment to add. I do want to thank again, Renee, for the high level of quality research that went into this presentation. Um, and I always, I think to speak to people's points about like the cultural strength um, a- of the Cuban medical system, and then also that backs the Cuban medical system, and then also just like the internationalism. um, I always like to think of how the enemy talks about this stuff, mostly because it's really helpful to dismantle, and I think it helps us in our spaces where, that might be the only rhetoric that people hear, right? I had a Cuban history professor in university. He was from Cuba. He got his degree from the University of Havana. And he would even admit that when he was growing up in the 80s, that Cuba went through a golden age. Um, but nowadays, he spends his time, in academia, just kind of hypercritical, and, everything evil and horrible goes back to like Fidel, or, the socialism or whatever, right? Um, and I remember speaking up pretty adamantly about like the medical brigades and the strength, and the kind of generosity, right, that they exhibit towards, countries that cannot have the resources, right? I remember during the peak of the coronavirus, Cuba had a program for countries who could not afford the normal, Pfizer or Moderna or Johnson & Johnson vaccines, so that they would have them at fixed prices to buy, or some countries even qualified, or requested instead that, instead of just giving them the vaccine, if they could send doctors. In some instances, Cuban doctors even gave like the equipment necessary to manufacture those vaccines to specific like Latin American countries. And the only thing that my professor could really talk about is that it was like brownie points, that was like some sort of social credit, that the Cuban government does. But obviously we know, and then once we tell people about this critical information, like it's impossible to see it that way. It's the only really possible way to see it is the genuine like solidarity that those doctors and that those people have, right? Like, if they didn't have like a deep root, like a deep connected like root to the importance of like people's health, the care and like wisdom that goes into being like a medical practitioner, then they wouldn't do it, right? Then they would refuse to go. There wouldn't be these like massive solidarity brigades, but they care, they deeply care. Um, and I just wanted to kind of share that. But I think, just kind of respecting people's time. I think, unless Renee, unless you have any like kind of like last closing thoughts for us.
I really don't. I really appreciate everybody's time and attention and support. That means a lot. So thank you.
All right. Well, thank you guys. Thank you, Renee, for being our speaker for tonight. And just kind of a few reminders. Um, we have a Action for Cuba committee meeting coming up on the 28th. Um, we have our next PE session, which is next week on Thursday, same time and space. And yeah, so thank you guys, and have a wonderful rest of your evenings and nights.
Thank you. Good night, everybody.
Good night, guys.
Thank you, Tobin.